In light of the COVID-19 pandemic, TIZ is against corruption in the humanitarian aid distribution. TIZ calls for transparency during arrival of aid, transparency during selection of beneficiaries, transparency during distribution of aid, accountability in monitoring the process of aid distribution, and depoliticization of aid. Resist, reject, and report corruption now. Transparency International Zimbabwe, a coalition against corruption.
Welcome again on Asaki Online. My name is Zenzele Ndebele, and this time I'll be talking to Dr. Ruth Labode, who is an MP and chairperson of the Health and Child Care Parliamentary Portfolio Committee. We'll be talking about the issues of health, corruption, COVID. This is a program brought to you by Transparency International Zimbabwe, and we always encourage transparency and accountability in our public as well as the private institutions. Welcome to the program, Doctor.
Thank you very much.
Yes, you had such an important portfolio committee of the health. We are in a health crisis at the moment. Do you think as a country we were prepared for this situation?
We were definitely not prepared. We were not prepared because this thing came and found our health system in ICU. So it meant that if we could not treat pneumonia because we have no drugs, we definitely could not manage COVID-19. We did try. I think initially when the COVID epidemic was in China, we assumed we would just have people who are carrying the COVID and not serious issues like the Zororo case where you need ventilators. So when we visited, for example, Wilkins, we were so happy with ourselves because there were some protective clothing and the place looked clean. There were no patients, but it looked like we were ready. But we did not anticipate that even the plugs were wrong. And we did not even think of looking for a ventilator because a ventilator is normally in ICU. We were looking for an isolation center. So we were definitely not prepared. And worse still, we did also not plan for our lockdown or whatever strategy we took to decide what we are going to do. We began copying from the neighboring countries, whatever they were doing. Because for us to be in a lockdown and only test less than 500 people, it's a disaster. We haven't done anything. It means we will have no reason. We don't know how we are going to come out of this lockdown. Because if you have only tested 500, it means, and South Africa has tested over 100 and something thousand. So we are worse off now. Our plan was very, very poor. So I'm saying, and we forgot to say, if people go on lockdown in a country where over 79% unemployment, people depend on vending, and then you go on a lockdown, how are they going to live? That also we did not think of.
You raised quite a number of important issues. Maybe just making follow-up, starting with the visit to Wilkins. Would it because people didn't know what they were actually looking for? They were just when they looked for the buildings and the beds and not the nitty-gritties of the disease.
You're right. I led that delegation. I was looking for an isolation. I once ran Thorngrove Hospital for TB. And the hospital, if you went to Thorngrove today, the TB section is spotless clean, white tiles, everything, and the medication. But we never had an ICU. We were never treating very serious people. We were isolating people from transmitting TB. So in my mind, that's what I had. We were looking for a building where nurses can protect themselves and doctors, and beds for people to wait there until they're negative.
So this is happening at a time when Parliament is not in session. And as the Health Committee, do you have means of communicating with government to say, guys, can we do this? Or it's just you're also on lockdown?
Parliament, in fact, even just like I told you, the planning was very poor. We arrived in Harare from a tour of COVID centers, only to be told in our hotels that Parliament has closed. we just cut off like that. We did not even draft the report. We were not given that chance to even report to anybody, not minister, not the speaker himself. So we have no contact as it is, except for the reports we get from the minister through TV and the emails from the clerk, which are really coming from the minister. It's very unfortunate because we seem to be able to communicate more with other parliaments. Like the European Parliament were talking to me just the other day on what getting my opinion. This afternoon I have the World Bank parliamentarians meeting on a virtual, what do you call it?
A virtual platform.
Yeah, exactly. Yeah. So I really feel Parliament has been taken off. The ideal situation would have been once there was a cabinet task force, then there should have been a subcommittee of the cabinet task force, which involved the committee on health, doctors, senior doctors, probably somebody from procurement, an accountant, just to feed into the cabinet to say, no, the way you are taking this is right, the way you are doing this is oversight and advice. That did not happen.
Yes, for those who are joining us online, we are talking to Dr. Ruth Labode, who is the chairperson of the Health and Child Care Parliamentary Portfolio Committee, and we are discussing COVID and the oversight of the Parliament. I mean, one of the issues that we have seen in the last few days is quite a number of organizations, international organizations, individuals donating monies and products to Zimbabwe. And Zimbabwe has always had issues with accountability. You know, we are accused of not being so accountable. What measures are in place to make sure that all these donations and the monies actually will end up in the right hands and getting to the beneficiaries?
In my opinion, it's very sad actually, because I hear through the social media, or such and such a person has donated this organization wants to donate this, you read online, people are receiving, including government, but there's no accountability. But if you look on the South African platform, you notice that they will say, our crowd fund is now sitting on 13 million. This is what we want to hear. We want to know as a nation, so that post-COVID, when we are doing oversight or even monitoring what happened, we will know what was available. But as it is, when COVID is gone, who are you going to ask? That is going to be a huge problem. There is because people want to steal or want to make money out of this disease, they will not report. And what is worse, what is worrying me is even the procurement procedures. You hear Tagwire donated 15 ventilators. The poor Tagwire could have genuinely donated 15 ventilators, but whom did he send to buy? That company that bought, instead of saying a ventilator costs 20,000, they may say the ventilator costs 40,000 and get away with it. And there's nobody, there's no oversight.
You raise quite important issues. You've talked about the accountability, you've talked about the procurement itself. Mm-hmm. So is this not a fertile ground for corruption?
Oh yes, it's actually a fertile ground for corruption. The fact that there's nobody is a fertile ground for corruption everywhere. Even the policeman who is supposed to be policing the lockdown is collecting money from cars, allowing them to go to town or allowing them to go where, is stopping people. So they stop a bus and they take women out of the bus unless you pay something. That's corruption also.
So the country is on lockdown. Procurement is happening. So that means procurement procedures are flouted.
Oh yes.
What kind of mechanism is in place to make sure that whoever gets the tender, there are 3 quotations and there is ABCD?
We are in a war room. People who hide behind it that it's an emergency. Even if it was an emergency, we should have had a skeleton team of people doing that oversight. Have you noticed when these countries like America are reporting on COVID, it's not only politicians, it's a whole team. Even CDC is there. That tells you that they've really gone out of their way to ensure that what's happening, everybody knows what's happening. There's a doctor who refused to use a certain drug in America, which was being proposed by Trump, because he thought there was some flouting of a tender, that somebody was trying to promote somebody. Why are we 7 salani drug chloroquine? He's been fired, but it's fine. But he stood his ground, and that drug has been taken out also, because it has been found to have killed people. But there is a thing. Those eyes are necessary. We are human beings.
Look at, we've had problems with issues like command agriculture, where a lot of money ends up going to individuals. Here we are talking massive millions of dollars that are being used. And for example, the money that is being said to be sent to individuals, do you have an idea how the money is distributed?
We have no idea. And I do not understand even why they chose to use one network to distribute this money. That alone means that that network can be manipulated. They should have used to say, this is Zenzel Ndebele's phone number, we want to help him because he's in business, then let's send him money. Then it's easy for all these networks cannot be agree or in cahoot to agree to hide things. This money is not coming through. Now, I was reading this morning, Minister Mavima saying we're only going to give 200 bond per family. So we want to know 200 bond to how many families, from how much? That's what we want to know. Just saying 200, you could give 10 families. Tomorrow you come to Parliament and say, during COVID, we distributed 1 billion to the pigs and that. How are we going to argue?
You know, we have had a lot of complaints from doctors complaining about the protective clothing and all these kind of things. Yet, ordinarily, Zimbabwe has a lot of taxes that are going towards the health. We have 5% airtime tax, we have the AIDS levy, we have all these kind of things. What happens to this money?
These monies, in normal circumstances, actually become the budget for Ministry of Health, because the monies government declares to say we have given Ministry of Health 300 and something 50 million is never dispersed. You may find that halfway through the year they've received something like 25% of what they should have received. The question then you have to ask yourself, how did they survive? So which means those monies which they should have gone to say this is for emergency preparedness, the Kuna says these was sevenza.
So you've been a doctor, you've headed some of these health institutions. You know, looking at the situation now, what do you think is going on in these health institutions?
It's tough. I recently visited Mpilo. I listened to consultants who were in tears. They were saying patients who need dialysis are not getting anything. The hospitals are in crisis, literally. And also, because of the economic situation and because you are underfunding doctors, they then charge people who should not be charged. You meet a doctor at a surgery, he collects $1,000 from you for an operation, then he says, hambe mpilo. Ufike nje ube normal, uyafika ngale admit nguye, sulele esibhedlela for free as a government, then he operates you and you go. He works also at Mpilo, so that's his payment. So you are now having to pay for something you should not have paid. That is corruption, but it's because the situation is fatal for that.
So at one point when you go to Parliament, your committee, are you going to sit down and then analyze each and every donation that was given during this time?
For us to be able to analyze, somebody will need to come and give a report first. And say, we'll ask for a ministerial report, definitely, of donations. He will bring that report and then we'll analyze and follow up on especially the donors.
But by that time, the money will have been spent.
Of course. And the other is, you are assuming you'll be told the truth. You are assuming the declaration will be truthful. And there's a lot of money also coming to individuals. Somebody was telling me that they've been given a donation from America and they are making masks in Mahachula. How much money? They didn't say. How many masks will be produced? They didn't say. Where they take those masks, we don't know.
Yes, you are actually raising one important issue, that it's not only government where we face corruption, it's also individuals. Yeah. And I was saying last week when I looked at GoFundMe platform, there were 56 donations or initiatives on COVID on Zimbabwe. And the people were getting various amounts of money from people. How can we make sure that also individuals who are collecting money on behalf of others, they actually hand over that money to the... Because I've seen funding for Mpilo, for Thorngrove. Do you think these monies will get to these beneficiaries?
I have my question mark, and I don't know how we can actually follow up on those monies. Maybe once in a while we need to call on some of the people who initiate a GoFund and say we would want to market you. Tell us exactly where you sent your money. I think we need to do things like that.
Yeah, because the corruption is not only at government.
No, it's not.
Yeah.
It's not. Even a lot of civil society organizations will divert their usually responsibility and go to COVID because that's where the money is. Especially when you're distributing food. When you're distributing food, it's easy for you to steal. Because it's ill-defined, you don't know, there isn't that's why one time people screamed at me when I said, why don't we use the ZEC registration to distribute food? Because I feel when you say household, how many amalocha bangageyatin? Kunzima lokwa. We don't have a database for Zimbabweans. Go to Rwanda. The Rwanda government knows every Rwandese who is in Rwanda. But decide we are distributing here. They know exactly who is here. But we don't have that data. Because of that, that creates corruption. You can get away with it, you get a lot of, especially in gendered corruption, because women tend to stay in one place, men tend to have so many small houses. So you don't know where they are going to actually put their allegiance to, or which money they will collect, or they will collect 3 or 4 times what they're supposed to collect.
You mentioned the issue of databases, and the last 2 weeks we've been moving around food distribution points. The distribution of meal or the selling of meal has been so chaotic.
Yeah.
I mean, what can be done to make sure that, because at the end of the day, those who are known end up getting the meal, but the ordinary person ain't taking.
Yeah, I know. If I had my way, government should have actually taken all the money they said they are 200 on allow. Gone and bought meal, distributed meal weekly to every household. Go house by house. If there are 4 lodgers, let them be known. Distribute meal free every week. I'm a 10 kg. We would have sorted these problems. Then we are in a lockdown. A truck must just move, arrive in Tumbane, distribute meal. This nonsense the government is trying to get, is it 20 bond or 30 bond from selling meal at the expense of killing people? It's not worth it. And that's what is creating a black market. You find other people phoning and saying, I have meal for sale, but unless you have a way of getting it.
Now, as we get to close, I mean, how do you think a COVID pandemic is going to impact on the life of ordinary Zimbabweans, even post the pandemic?
Post-pandemic, Zimbabwe, we're going to have absolute poverty. And I can see us even getting diseases which we had gotten over, like marasmus, or kwashoko, diseases that relate to food. Right now, children are dying of hunger in the they are locked up, the parents have no money, and there's nothing they can do. They were surviving on selling airtime and buying a bag of meal at the end of the day, but now they can't do it. And then they are not connected, like you said, to be able to buy meal or to even get it for free. That is where, then we have another situation that I'm seeing that's going to happen. You will find that we'll be a country of rogues. Amasela zatwala. Because people must survive. We must anticipate this. And then we should expect a bumper of children and a bumper harvest of children who are going to be born. People are busy having sex in the lockdown because they're bored. But also the youngsters are having sex and they cannot access contraceptives. When they want to go to town, they are stopped and told, go back. And then they go back home and then they find themselves pregnant. They go to the nearest person that if they want to try and have an illegal abortion, either die or end up being rushed to Mpilo, creating an expense for Mpilo. A complicated abortion is more expensive than a normal sought-out abortion. If you are complicated, it means sufunama drip, sufunama beta, sufunama antibiotic. This is why you find our Zimbabwe spends about 1,000 managing a complicated abortion. While Ethiopia, they are charging $20 for a normal abortion if you feel you got pregnant without planning for it. And that is going to happen. You find a lot of young people can't get their ARVs from Pilo. Lockdown. They are told you can't go. But people are not given enough time to go. And even if they were given time, there's no way you could have rushed to the Pilo and I am in 1 week, including so you are stuck there outside Natama ARV. And you are busy doing things there. We have a disaster.
You're actually frightening me when you're talking about these issues, because these are the issues that probably an ordinary person would not have thought about, and probably the government also is not thinking about, because everyone is focused on COVID.
Yeah.
I mean, to citizens, what can you say?
To citizens, what I can say is, please try and keep that distance. Social distance is very important. And try, please, even if you go for, I went to TM, I joined the queue, and I kept on insisting when the person behind me tries to get close to me, move. You have to protect yourself, but also in the process you protect the next person. The name of the game right now is, let's stop transmission. We have to stop the transmission. If we get into winter without knowing where we are standing, we are going to be another Italy, and we can't cope. We don't even have ventilators. 6 ventilators, 15 is not enough. We cannot manage there. I think very often past standards. Uti nkulunkulu sizwela uyakwazi ukuthi vele thina sizilima. Lokhu singake sakwanisa.
On that note, I mean, I think we encourage people to stay at home, because the challenge that we're having in Zimbabwe is that we're going towards winter, and the combination of winter and COVID will be very disastrous, as the doctor is saying. My name is Zenzele Ndebele, and today in our program, which was brought to you by Transparency International Zimbabwe, we're talking to Dr. Ruth Labode, who is an MP, as well as the chairperson of the Health and Child Care Parliamentary Portfolio Committee, and we're talking about corruption, accountability, because we have a lot of donations that are flying around from individuals as well as government, and accounting for this is going to be difficult, and we're encouraging people to be always transparent, communicate with the next person, but also don't collect money on behalf of people and never tell them. At the end of the day, there has to be accountability. Those who are supposed to receive donations are supposed to receive it, but we know in every situation someone is going to benefit. My name is Zenzele Ndebele. Till we meet again tomorrow, have a good day.
In light of the COVID-19 pandemic, TIZ is against corruption in the humanitarian aid distribution. TIZ calls for transparency during arrival of aid, transparency during selection of beneficiaries, transparency during distribution of aid, accountability in monitoring the process of aid distribution, and depolitization of aid. Resist, reject, and report corruption now. Transparency International Zimbabwe, a coalition against corruption.